Everyone, we're Jamie, Chloe, and McKinley. Today we're going to present on sepsis, which is a life-threatening medical emergency. We will explain what sepsis is, why it is important in nursing, and demonstrate a real-life scenario through a skit to show how early recognition and interventions can save lives.
Sepsis is defined as a life-threatening organ dysfunction caused by the body's extreme response to an infection. Instead of fighting the infection normally, the body overreacts, which can lead to tissue damage, organ failure, and death if not treated quickly.
Sepsis is a major global health concern. According to research, there are nearly 49 million cases and 11 million deaths worldwide. Many of these deaths are preventable with early recognition and timely treatment, which highlights how important the nurse's role is.
Early recognition is the most important step in preventing complications. Nurses should watch for increased heart rate, fever, rapid breathing, low blood pressure, confusion, or altered mental status. Using tools like the new 2 scoring helps identify high-risk patients quickly. If something feels off, nurses must act immediately.
Once sepsis is suspected, treatment must begin immediately. This includes drawing blood cultures, measuring lactate levels, starting IV antibiotics within 1 hour, administering IV fluids, providing oxygen. Delays in treatment significantly increase the risk of death.
Nurses play a key role in continuous monitoring, recognizing early signs of deterioration, activating sepsis protocols, communicating with the healthcare team, and advocating for the patient. Because nurses are at the bedside, they are often the first to detect sepsis.
Now we are going to act out a scenario that demonstrates how a patient with sepsis may present and how nurses can respond.
Help! Please help! Something's not right!
I'm gonna. Hey guys, I'm Chloe. I'll be the nurse for today. Can you tell me your name?
I don't know, I'm just very tired.
He's been breathing really fast. He won't eat, he won't drink.
Oh no. I'm gonna go grab some stuff and check his vitals. Okay, I'm back with the vital supplies. Alrighty, temperature's 102.5. Alrighty, the blood pressure is 92/54. Oxygen saturation is 90%, and count your heart rate. (124) and respirations are 28. These findings are very concerning. I'm concerned about sepsis. His new 2 score is very high, indicating high risk.
All right, I think what we're going to do is activate the sepsis protocol immediately then.
Okay, I'm starting the sepsis bundle now.
Okay, keep me informed.
Okay. So I'll need to get some blood cultures, run some fluids. Sure we'll need oxygen. Knock, knock, knock. Just gonna grab these supplies. Put them on the table. You know how I do it, right? Okay. Put on my gloves. Okay, Mr. Ortiz, if I need to grab an IV on you. We're using the translator. make sure this flushes well. Alrighty, so now I'm gonna draw these blood cultures and send them to the lab, including lactate. I'll set this off to the side. I'm just taking some fluids, okay? There's some sort of hole. I thought it. Alrighty. Now we'll hook this up to your IV, clean it. 30 seconds. A minute. Make sure it's all opened. Okay. Here you go, Mr. Ortiz. I'm gonna hook you up to the nasal cannula. Does that feel okay? Okay, I'm gonna put him on 2 liters. And now I have some broad spectrum antibiotics for you. I'm ready. All right, let's clean the site. It's always important to. Alrighty, so now we're gonna administer your antibiotic and clean the site first because that's the most important to prevent further infection. I'm gonna push your antibiotic. Perfect. Time is crucial. Antibiotics must be given within 1 hour.
Can I stay with him? Can I pray?
Of course, we will always support your beliefs. We will be sure to call an interpreter to ensure there's clear communication. The blood pressure is now 86/48. Mr. Ortiz. Mr. Ortiz. He's becoming less responsive.
He's deteriorating, even with the fluids. Calling a rapid.
Hey, I'm calling about Mr. Ortiz. I just checked his blood pressure and it's 86/48, and he's becoming less responsive.
Okay, so we're gonna start some vasopressors and prepare him for an ICU transfer.
After rapid intervention, the patient is stabilizing.
Blood cultures have confirmed that pneumonia is the source. Antibiotics are working.
Because we recognized sepsis early and acted quickly, the patient survived and was discharged home.
The key takeaway is early recognition, rapid nursing interventions equals a saved life. This project explores nursing issues of early recognition and management of sepsis, supported by evidence-based practice, and applies to a realistic patient scenario. Priorities in sepsis care. The first is early recognition. Early recognition is the most critical factor in preventing organ failure and death. The NICE guideline update emphasizes the use of the NEWS2 scoring system for all adults with suspected infection, stating that failing to recognize clinical deterioration promptly can be potentially life-threatening. The key recognition priorities include identifying subtle changes in the vital signs, calculating the NEWS2 score, recognizing red flag symptoms like mottling, cyanosis, and an altered mental status, escalating care immediately when deterioration is suspected. The 2023 Systemic Review on Nursing Rules reinforces this, stating, nurses are uniquely placed to use clinical guidelines and make rapid detection of the syndrome and then activate appropriate interventions.
This scenario shows how quickly sepsis can worsen and how early nursing interventions can make life-saving decisions.
Nurses have a legal and ethical responsibility to act quickly when sepsis is suspected. Failure to provide timely care may be considered negligence. It is also important to use interpreters to ensure patients and families understand what is happening.
This case highlights how quickly patients with sepsis can deteriorate and how important clinical judgment is. Early recognition, rapid intervention, teamwork, and communication all play a role in saving lives. Thank you for listening. The update on the current nursing practice. Sepsis care has shifted towards standardized evidence protocols. The NICE guideline update emphasizes national standardized of the NEWS2 scoring to reduce variation in practice. The PLOS1 review highlights that nurses are often report barriers such as the lack of training, heavy workloads, poor communication, and limited confidence in sepsis assessment. However, when nurses receive structured education and use validated tools, outcomes improve drastically. The 2023 review found that nurse-led pathways reduced length of stay by an average of 3.7 days and improved a 30-day survival. The evidence supports the needs for routine sepsis screening, mandatory education, clear escalation pathways, and interdisciplinary communication.
Legal and ethical considerations. Sepsis care carries significant oh my gosh. Okay.
Just started wrapping it up.
Yeah. Okay. Legal and ethical considerations. Sepsis care carries significant legal and ethical implications because delays can result in preventable harm. Ethical responsibilities include acting promptly when deterioration is suspected, escalating concerns without hesitation, providing clear communication to patients and families, ensuring informed decision making. Legally, failure to follow sepsis protocols may be considered negligence, especially when evidence-based guidelines clearly outline the required actions. The BMJ guideline stresses the importance of timely intervention to prevent harm, reinforcing the nurse's duty to act.
Across all three peer-reviewed sources, the nursing role is consistently described as essential. The 2023 systemic review states, training has a decisive influence on practice and can lead to faster, assertive, and confident interventions in all stages of sepsis. Nurses are responsible for continuous monitoring, identifying early deterioration, escalating concerns without a delay, initiating sepsis bundles, advocating for timely antibiotics, educating parents and families, and collaborating with interdisciplinary teams. Nurse-led sepsis pathways have been shown to improve early recognition, reduce mortality, and shorten the length of stay, and improve communication and escalation. One study concluded early sepsis recognition by nurses may have reduced the progression of the disease and improved survival.
Timely management. Once sepsis is suspected, time-sensitive interventions must begin immediately. The NICE guideline provides antibiotic timing windows. High-risk NEWS 2 greater than or equal to 7, you should give antibiotics within 1 hour. Moderate risk NEWS 5 to 6, you should give antibiotics within 3 hours. Low risk NEWS 1 to 4, you should give antibiotics within 6 hours. This guideline states, for people at high risk, give broad-spectrum antibiotics IV within 1 hour. Additional management priorities include obtaining blood cultures, measuring lactate, begin IV fluids, identify and control the infection source, and reassess frequently. The PLOS1 review found that nurses often lack confidence in early sepsis management, but education and structured protocols significantly improve this performance.
Cultural and spiritual considerations. Sepsis affects patients from all backgrounds, and culturally competent care is essential. Nurses must respect cultural beliefs about illness, infection, and end-of-life care, provide interpreters when needed, include family in decision-making when culturally appropriate, support spiritual needs during critical illness, and avoid assumptions about patient preferences. These considerations improve trust, communication, and adherence to treatment.